the digital community health systems. I can see there are people joining from different parts of the world. So your diverse perspectives and experiences will enrich our discussion today. So my name is Shreshth Mawandia. I'm the project director for Data.FI. Data.FI is a USAID-funded global project led by Palladium that helps countries strengthen their health information systems and improve client care through integrated digital health solutions. I have the pleasure of moderating the webinar today. Just a quick housekeeping rules before we get into the meat of the webinar. Please keep your microphone muted when you're not speaking. Feel free to use the chat function for questions and comments. We really encourage you to turn your camera on when you are speaking. And if you're having bandwidth issues, please feel free to turn the camera off. We will be recording this session, and then the link will be shared with all the registered participants after the session. So welcome again, and we look forward to a productive session and explore how this toolkit can enhance digital community systems. This is our agenda. As you see on the screen, we will provide the need and context behind the community digital health systems, share the content, discuss the significance of the person-centered approach, and then share some success stories from the field, which will be followed by an interactive question and answer session. Next slide, please. So what made this toolkit possible? Let me start by extending my deepest gratitude to the USAID team for their leadership, their funding, and technical contributions for this toolkit. Particular appreciation for USAID Office of HIV/AIDS, US Centers for Innovation and Impact, and the USAID Southern Africa Regional Health Office. I would also like to acknowledge Digital Square, who co-organized and co-facilitated the Southern Africa Community Services Workshop, where the toolkit was conceptualized. Last but not the least, the Data.FI team and the technical experts who have been instrumental in shaping this resource. Next slide, please. So this is our expert panel for today. We have Amarynth Sichel, Senior Digital Health Advisor at USAID. We have Netsanet Animut, Senior Technical Advisor at Palladium. Joy Kamunyori, Senior Health Information System Advisor at USAID. Sriyanjit Perera, Digital Health Advisor at USAID. And Pascal Mwele, Technical Director at Data.FI. With that, let me hand over to Pascal to kickstart the presentation. Over to you, Pascal.
Okay, thank you very much, Shreshth, and confirm that you can hear me.
Yes.
Yes, thank you very much. As introduced, my name is Pascal Mwele. I'm the Technical Director at Data.FI. Please let's move on to the next slide. And I'll be taking you to through the context behind why the digital community system and why does it matter. And the reasoning behind this is that in our engagements across countries, we've seen that there is an increasing demand for integrated services at the community level. Of course, this is driven by the shift and emphasis towards person-centered care, PHC, the personal healthcare approach, and many countries moving towards this. There's also a big shift, a paradigm shift, more towards digital innovation, whereby many services are being digitalized, and there's digital transformation that's driving that. And then finally, we're also seeing a lot of complexity as people become more aware of the potential of digital solution, and the complexity also increases with that. There are many legacy challenges around siloed systems that have been entrenched in our systems for many years, many manual-based systems that have been there for many years. There are data gaps, there are resource constraints that have led to really systems at the community level being suboptimal. When we look at the digital community systems, what is the promise? The promise here is that if we take a person-centered approach, please go back. when we look at the person-centered approach, we are looking to improve service delivery, and this is a shift from being building systems that are primarily meant for data capture, but more driven for service delivery. We are looking at enhanced collaboration and also driving equity and access. The barriers that are well known are around fragmented approaches, resistance to change, and limited infrastructure. So as a result of this context is what brought about the need for coming up with a structured, person-centered approach that provides a user-friendly, integrated approach. Next slide. What is a digital community system? It's a set of ICT tools that are providing integrated data-driven community services. And this takes a person-centered approach. And the idea behind this is that you have just to collect data once, use the same platform to collect data from using a multi-sectoral approach. And for community systems, what you're seeing is you're looking at health data, social services data, different types of data. And even when we are looking at a One Health approach, there are different types of data that could be collected. So in this sense, you're looking at a multi-sectoral approach, having high-quality tools that provide a way for efficient collection of data. As we are shifting more towards having smart data, it's really incumbent upon us to provide tools that can then allow for data to be collected once and then used multiple times. There are technologies that allow for that. And so the promise of a digital community system is to provide a very structured approach of how the technologies and the ecosystem can be brought together to develop such a community and to then cultivate an ecosystem that allows for these digital systems to thrive. So with that, I'll hand over to my colleague Netsanet to talk us through what are these tools and what is the toolkit, what is contained in the toolkit, and what is the promise that this toolkit provides. Over to you, Netsanet.
Thank you so much, Pascal. Good morning, good afternoon, colleagues. My role here is to walk you through a toolkit designed to help you create digital community systems that are person-centered and integrated. I'll cover the toolkit's objective, key features, and how it supports everything from workshop planning to technical implementation and long-term sustainability. Next slide, please. Yes, to start from the key objectives of the toolkit, it's primarily designed to support countries or organizations interested in running multi-sectoral workshops aimed at designing digital community systems with a person-centered and integrated approach. Specifically, there are three main objectives, as you can see from the slide, that the toolkit seeks to achieve. First, it offers clear and actionable guidance to conducting collaborative workshops focused on a person-centered design approach for digital community systems. And the second objective is to provide deep insights into the technical aspects of the digital community system. This toolkit covers crucial topics like system architecture, interoperability, standards, product selection, and how to integrate new systems with the legacy systems. I believe this helps participants understand the technical side of digital community systems and ensuring that the systems we design are not only practical and scalable, but can also evolve as the needs of the users change. The last but not least objective is to support post-workshop activities by offering resources for strengthening governance, developing roadmaps, and establishing frameworks for monitoring and evaluation. Next slide, please. So you may probably wonder why this toolkit and why now. I think I can talk about why this toolkit is so timely and needed right now. As you all know, we are with a rapid expansion of digital health solution, as Pascal has alluded in his context talk, across countries and sectors, and it has become clear that the systems need to be designed with users and needs and preferences at forefront, not just driven by the technology alone. The toolkit also plays a crucial role in fostering collaboration among a diverse group of stakeholders. As you can imagine, we're talking about these multi-sectoral stakeholders working at the community level. And this collaborative approach is key to creating systems that are not only functional, but also tailored to the real-world needs of the people they are designed to serve. I believe another key core consideration in our digital health programming is sustainability, and the toolkit has also taken that into account by providing a structured approach for designing digital community systems that are not only effective in the present, but also adaptable to future challenges. By integrating flexibility into the system design, we ensure that the solutions will continue to evolve and meet new needs as they arise. Next slide. Looking closer at the key features of the toolkit that make it such a comprehensive resource for designing and implementation digital community systems is that the first key feature is the digital community system workshop planning and facilitation tool. It provides a step-by-step guidance for organizing and conducting collaborative workshops. It took us months to prepare for a similar workshop last year in Cape Town, and that process can be reduced through the use of this toolkit, and a lot of the thoughts behind preparing that workshop has been captured and included within this toolkit. The second important feature is it has included person-centered design approach. This ensures that the systems we develop are focused on understanding and meeting the real needs of the actual users, be it the community health workers, the social workers, the clients, the nurse at the facility. Everything needs to be considered, identified, defined, their preferences and needs to be captured, and you need to identify your use case and translate those use cases into functional requirements. For technical implementation, the toolkit also offers best practices for system architecture, interoperability, platform selection, and other related aspects of agile program management. The solutions we create, this helps us for the solutions we create are not only effective today, but also integrate with other systems, scale up as needed, and scale with the emerging technologies. And finally, it also has some features around country-level roadmap development. We have included some content around how we can map out the toolkit plan with the specific steps needed to implement the digital community system at the national level. It ensures that each country has tailored plan with a broader digital health strategy, as well as the goals that have been articulated in the broader health and social services strategic plan. Next slide, please. So some of the highlights of the toolkit, it's structured into 5 main sections, each designed to guide you through different stages of the digital community system design and implementation process. The first section is about an introduction. Here we emphasize the importance of person-centered design and integrated design approach, which are key to ensuring digital solutions truly meet the needs of individuals and communities. This section actually sets the tone for the rest of the toolkit, laying the groundwork for collaborative, user-focused work that will follow. Moving to section 2, we also provided detailed guidance on workshop planning. It covers defining clear workshop objectives, setting the right duration for each of the sessions in the workshop, selecting participants and facilitators, and other important considerations, including evaluation of the workshop daily and at the end. The third section is about person-centered and integrated design processes. It covers how to conduct ecosystem assessment, which helps you to understand the current landscape of health and social services, as well as the systems being implemented at that level. It also outlines processes and tools to understand user needs, defining and prioritizing use cases, and translating those use cases into functional system requirements. Most importantly, this section also highlights the importance of strengthening governance across different levels, which is crucial for long-term success and sustainability of the systems design. For those managing the technical side of the design, section 4 guides you in translating design ideas into practical solutions. It covers everything from system architecture and standards to platform selection and agile team management. This ensures that your technical decisions are not only aligned with the user needs, but also scalable and adaptable to future changes. Finally, the last section is dedicated to developing a country-level roadmap for digital community systems. This section provides tools and frameworks necessary to ensure that the system aligns to national strategies, integrate with broader health and social services goals, and involves collaboration with key stakeholders. Next slide, please. Yeah, before I go that, throughout the toolkit, you will find wealth of additional resources to support you in each step of the design and implementation process. This includes case studies, templates, and practical tools that can help you make more efficient and effective use of the toolkit. Finally, it's about the target audiences for this toolkit. I think almost everyone involved in the planning, design, development, and implementation of digital tools for community services can benefit out of using this toolkit. Whether you are a government official, healthcare provider, social service professional, IT expert, policymaker, or community worker, this toolkit is designed to support you in a wide range of stakeholders in creating integrated and person-centered systems. I think with that, I will pass it to Amarynth to take you through a person-centered design approach. Thank you. Amarynth, over to you.
Thank you, Netsanet. Yeah, so building off of what Netsanet was sharing, this toolkit is really anchored around two key concepts. One is person-centeredness, and the second is integrated design. And we've heard a bit from both Netsanet and Pascal about what these terms mean, but in this section, I'm going to break them down further and illustrate why anchoring around person-centeredness and integrated approaches is really crucial to this work. And yeah, so I'll start by providing a little bit of definition for these words because we hear them so often, maybe to the point where they start to lose a little bit of their meaning. So when I'm saying person-centered, what I'm talking about are digital tools that are designed around the needs of service providers and clients. And spelling that out might sound like a platitude at this point. After all, I think that human-centered design has been around as a concept maybe for longer than I have, but it's really worth re-emphasizing because improving user experience isn't always the goal for digital tools, especially in the health sector. Often we have digital tools that are designed to really help us get better data or facilitate better reporting. And while that's incredibly important for healthcare, that doesn't capitalize on even really half of the value that a digital tool can bring to service providers at the community level. So that's a little bit about what I have in mind when I say person-centered. And the second focal point for this work is around integrated design. And by this, we mean designing for digital tools that can support continuity of care across not just health programs, but also other health sectors as necessary. And I'll give you an illustration of what I mean by that. You can go to the next slide. So these two design principles, person-centeredness and integration, are anchor points because there are challenges that can arise from traditional design approaches that don't use these two principles as foundational. So I'm going to take us through a user journey now to illustrate what some of those challenges might look like. For this user journey, I'm going to focus on Zuri, who's a community health worker, Tendai, who's a social worker, and Stella, who's a 13-year-old girl. So travel with me to visit Zuri. She is a community health worker, and she is providing a routine visit to a household in her community when she notices Stella, a young girl who lives in that house. She's 13. She's not at school because it turns out she's dropped out. So Zuri, the community health worker, knows that there's a program to support adolescent girls like Zuri, but like Stella, but referring Stella to that organization takes time because at first Zuri doesn't have the right forms to do it. That delays the referral, which then delays Stella getting access to the support that she needs. But, eventually the referral does succeed and a social worker, Tendai, starts working with Stella. One day in a follow-up visit, Tendai learns that Stella is actually sexually active. Tendai then refers Stella to a health facility for HIV testing, but Stella loses the referral slip because it's a piece of paper and she lost track. It fell out of her pocket. Tendai covers a really wide catchment area, so she's not able to check back in on Stella for a while. She's hoping that Stella went to the health facility, but she's in the dark. She doesn't know if that happened or not. And it's over a month before she can go and check in and see if Stella got the care that she needed. In this slide, each of those red exclamation marks on the user journey represents a potential pain point for the care provider and a time when services, were potentially delayed. And while in our user journey, everything goes well in Stella for the end, she gets the care that she needs. Sometimes these delays can actually be really harmful for people. Next slide. The driving thesis for this toolkit is that you can use digital tools to help address those pain points that both service providers as well as clients experience. And you can do this by designing with the user's daily needs and challenges in mind. So this image here represents some of the capabilities that Zuri might be able to gain through using an integrated person-centered digital community system. And this is just from the perspective of the community health worker. There's a different image of what this could look like if you thought from the perspective of the social services provider or from the client themselves. So each little blue circle here represents a use case that would address a pain point in that previous user journey. And I'll just walk through a few of them. So for example, you can see on the bottom left, a digital tool could help facilitate a direct referral of the client, Stella, to the social workers organization. So Zuri wouldn't have to go find that form. And Zuri could even be updated on the outcome of the referral. So she'd know whether, she'd know whether Stella was able to access care through that organization. Zuri could share key information about Stella with the social worker that's relevant for the social worker's work. And then Zuri could receive notifications about, for example, the referral to the health facility. So she could follow up with Stella to make sure that Stella was able to go. By addressing some of the challenges that Zuri faced, a digital community system can both make Zuri's job easier and also support integrated care and support for Stella. Next slide. So the two previous slides were trying to illustrate what status quo might look like, and then what a digitally transformed service delivery option at the community level might look like. But obviously, there's quite a lot of work that's required to go from status quo to digitally transformed. And so the toolkit outlines a planning approach that breaks down this process into steps, which can be done asynchronously or through a workshop or through multiple workshops. So the first step is about centering the users and involves building out user personas or detailed semi-fictional profiles of representative users. This first step also involves building out user journeys. So what do users do during the day? What challenges them? What motivates them? What needs do they have? How are those needs being met, or how are they not being met? This next step examines the personas and user journeys to identify pain points that digital solutions can help alleviate, and developing use cases around those pain points. The third step is to prioritize use cases, recognizing that we need to start somewhere, and we can't cram every functionality that we dream up into a digital tool all at once. And then the final step is to translate those use cases into functional needs, or needs that will inform how the digital community system is built. And with that, I will hand it over to my colleague, Joy.
Thank you, Amarynth. So it's one thing to take a person-centered approach to your design, and it's another to operationalize that technically. And for that reason, this toolkit includes a section that talks about translating your ideas into technical realities. Next slide, please. An effective digital system that supports interactions at the community level needs to be able to interact with and share data with multiple systems in order to properly support all the activities at the community level. So, for example, Zuri and Tendai both need to, in order for Zuri and Tendai to properly support Stella, they both need to be using a system that allows them to do things like make referrals to the health facility, as Amarynth mentioned, follow up on her medical appointments, directly communicate with Stella when they need to, and update her information after interactions with her as necessary. And this requires seamless data exchange with several other systems, such as the facility electronic medical records, the master facility registry, and the shared health record, among others. So this, in order to be able to do this, the system needs to be able to integrate with other systems and interoperate with them through the health information exchange. Next slide, please. So the toolkit goes over some of the technical concepts that it's necessary for implementers to understand in order to implement a system that supports comprehensive activities at the community level. These concepts include the National Digital Health Architectures, interoperability, and standards. So a national digital health architecture is a blueprint that describes how business processes, data, and digital health applications fit together and interact to support a large and complex health system. Interoperability is the ability for systems to communicate and exchange data efficiently. And standards are documented, reusable agreements on definition, format, and structure of data, which ensure consistency in data exchange. And altogether, interoperability and standards enable all of the components in an architecture to be connected and work together effectively. So when implementing a digital community system, it's important to understand where the system fits into the wider national digital health architecture, as well as which standards it needs to adhere to in order to allow interoperability within the health information exchange. And the toolkit goes into an overview of these concepts in order to help bring the audience up to speed on these concepts. Next slide, please. The toolkit also provides checklists for platform selection as well as for product development for those teams that may be less familiar with these processes in order to provide some guidance on how to go about them. I'll now hand over to Sri to talk about some country examples. Thank you.
Thank you, Joy. Good afternoon, everyone. So you can go to the next slide, please. USAID, I'm with the USAID Southern Africa Regional Health Office. And as a regional office, together with our USAID missions from the 5 countries we support, Eswatini, Lesotho, Namibia, Botswana, and Angola, we recognized there was a gap in our ongoing work in relation to community data systems. I think Pascal and the others have already kind of talked about what those challenges were. So we wanted to convene this regional gathering, create a learning experience that kind of emphasized all the key concepts the others have explained to you today. So we brought together this diverse multi-sectoral delegations from each country, and a lot of what was developed here in the toolkit was developed for the purpose of that first gathering. After the gathering, based on the feedback, we were optimistic that those in attendance kind of developed an appreciation or appreciated the concepts and changes that we were advocating for. But I think what's been pleasantly surprising, and even one of the reasons that sort of motivated the kind of packaging and release of this as a toolkit, was some of the successes and progress that they've been able to make since then. So the country delegations kind of equipped with the roadmap they developed during the week and the tools that were kind of developed to convene such a meeting kind of went back and started convening similar meetings in country, or applying some of the tools to their ongoing, let's say, system development requirements gathering processes. Next slide, please. So I'm not going to really recap all of the activities and actions that they did, because I think The others have already kind of summarized what that is for the toolkit, but a lot of it is doing similar gatherings, bringing people together, engaging with end users. But I wanted to maybe just talk about some of the examples, right? So in one country, as they worked collaboratively through the process, community health workers and social workers were excited about the idea of a system designed to support them, right? They're quite used to systems, and they voiced this in the meeting, the idea that they're used to systems almost being a burden for them, rather than something that actually helped them. And so they emphasized, for example, when they were planning it, something that they really wanted to look at more was how can they use the system to plan where they need to go, who they need to see, right? A tool that supports them, not just reporting. In another country, while there is progress on community data systems, the tools and processes from the toolkit were also immediately applied to their ongoing facility EMR development efforts. In that case, the HTS counselors, the nurses, and the patients involved were kind of engaged in some of that use case deliberations, and they prioritized use cases for patient scheduling, injection administration, follow-up, and monitoring for long-acting PrEP injections. Next slide, please. The Botswana team, they have some interesting stories of how their community data systems, let's say, stakeholder engagement has improved so much, both through this process and the processes that they've applied in country, where they convened again similar gatherings, used the tools from the toolkit and processes developed for the first meetings in order to get requirements for their new community digital systems. The tools were used to engage the users, document the processes. In particular, they were looking at both household and individual assessments. The end users prioritized the importance of the referral process between community and facility services. So even in the early development of the system, the users, their advocacy for this use case resulted in a pretty significant change in the team having to think through like what was in the first versions of pilots and everything so that they could devise solutions to achieve the use cases and align with the longer term architecture over time. In this particular case in Botswana next week, the team is going to be doing the training of trainers and starting the rollout of their community health worker PHC system that is incorporating these use cases prioritized by the users. Next slide, please. Lesotho was also a very exciting situation because even within the meeting, this diagram to the left was something that the team produced in that very first gathering, where it really captured all of the different personas involved with case management in GBV cases, right? And the complexity of how difficult it was for, and focusing on the user, but also focusing on the client as well, right? So the Lesotho team with the delegation from multiple ministries, they identified these actors and services involved in GBV case management when they were at the gathering. They went back with their roadmap and started implementing their roadmap. They used the tools and approaches again in local convenings and engaged with the users, figured out the functionalities to deal with it, and then they were used to prioritize which use cases they wanted in their first release of a new system. So it incorporated statutory case management for the countries. The users were very vocal and they wanted a broader system. They had an existing system that was kind of only very specifically dealing with some HIV use cases. And the community health workers wanted something that was broader, that still met their needs, kind of holistic. And, in line with the practices of the workshop and the tools here, they brought multiple stakeholders together. This included multiple ministries, police, courts, Global Fund, different funding partners, Global Fund, UNICEF, different IPs, all helped the system designers understand the workflow and business processes. Next slide, please. So, it's all a pretty quick recap. We're hoping the tools can be used. We saw value in them, and that's why we sort of helped the team put effort into helping to release them. But there's a need to continue. This is just the beginning of the process. What we're really hoping is that as more and more users become advocates, more and more system developers policy leaders, as more and more stakeholders become focused on the idea that these data systems aren't just about data collection, and if we design them to meet the user's needs, we can drastically reduce our change management costs, in terms of having to constantly trying to retrain and find many sticks to try and force people to use systems because they're only feeding data to higher levels. Systems that people see value in are using will ultimately be more sustainable and more likely to succeed. And I think one of the things we're trying to do across our region is constantly look for how do we engage in these learning opportunities? One other idea that we're working on at the moment is to gather up the requirements that all the different countries are developing and sort of collate them into a common resource, which could then be used by each country to sort of say, well, these are the requirements that we prioritized and we thought of, but what are some of the other ideas that other countries with similar challenges have come up with? And maybe we should consider some of those when we're doing our own prioritization and release management planning, etc. So that with that, I think that summarizes how quickly what we've been doing in the region. Let me turn it back over to Shreshth.
Thank you, Shri. Thank you. Thanks a lot. So for participants, if you want to download the toolkit, that's the link to the toolkit. Please feel free. It's open for everyone. We will also share the slides, as I mentioned, so you will get the link. Before we go ahead to actual questions, let me try to summarize some of the key points. Pascal highlighted that person-centered digital community system can integrate community health, social services, and other sectors into a unified data-driven ecosystem. Netsanet shared that the toolkit can help foster collaboration between governments, health professionals, IT experts, policymakers, community members. And through this, we can ensure that the systems that are built in country are client-centered, effective, and most importantly, adaptable to the future needs. Amarynth shared a use case story and made a strong case for a person-centered and integrated design approach. And these things not only strengthen the primary care system, but contribute to improved access to quality care and thereby increasing efficiency and impact. Joy, she shared how the digital community system can be integrated into the national system and how interoperability and standards enable all the components to be connected and work together effectively. And finally, Shri, as always, he demonstrated the toolkit in action and by sharing the progress that has been made in the countries and the most importantly, how this toolkit can serve as a comprehensive guide for countries and stakeholders in leading the digital transformation of community services. So participants, please share your questions or raise your hands if you have any question for our expert panelist. Let me kickstart the questions that I see. Amarynth, absolutely loved the use case persona you shared. And we have seen this happening so often in the communities, yeah? And you also so eloquently narrated how Toolkit addresses some of the most pressing challenges in designing and implementing person-centered, integrated digital system at the community level. So the question is there a plan to extend this approach to contribute to a broader digital health beyond the community systems?
That's a good question. And in fact, where I thought you were going with the question is there plans to extend this approach to make it more standard and make it easier to incorporate within existing and future plans for digital transformation at the community level? And that is actually something that I've been spending a lot of time thinking about. So I'm going to pivot your question.
Absolutely.
This is a sneak preview of something that we'll also be talking about at the Global Digital Health Forum. But I can share now that we are collaborating with the WHO, with Endless Network, with UNICEF, and a number of other partners, including Data.FI, on thinking through what it would look like to take this approach and apply it to the WHO's SMART guidelines. So for those of you who are not familiar with SMART guidelines, they are a standards-based approach to making it easier for software systems to incorporate WHO clinical guidance and other forms of guidelines. And typically, these SMART guidelines have been done by vertical sectors. So you are not thinking about the healthcare workforce that would be delivering treatment. You are thinking about just the disease vertical that you're operating in. And that's how the SMART guidelines were created. And we're really excited to be creating SMART guidelines that are focused specifically at integrated care at the community level. So really operationalizing this approach. And it'll be another tool within this suite of tools that can support countries in taking this person-centered approach. And a lot of the ideas that are coming through in that work are leveraging this earlier work. So very excited for this partnership to continue, and also welcome collaboration from everybody who's on this call. We'll be sharing information more broadly, but there's a community of practice that's supporting this work, and hopefully some pathfinder countries that would also be pioneering this work with us. So more on that to come, and very, very excited to continue this collaboration.
Thank you. Thank you. You're so kind, and the pleasure is totally on our side as well. And our technical experts, Netsanet and Pascal, will also agree how amazing it has been working with the USAID team on this toolkit. I have a follow-up question, and this is for Joy. Joy, in your experience in working in multiple countries, in multiple settings, and especially on your point on interoperability, what steps can countries take, and what kind of support the countries will need to realize this vision on a national scale?
Yeah, thanks, Shreshth. Yeah, I think, and I would also love to hear Netsanet's opinion on this, because Netsanet is also the expert on interoperability, more of an expert than I am, for sure. I think in terms of steps, really, what's important is, as I said, thinking about where this digital community system fits within the broader national digital health architecture, right? And so, in many of the countries that we're working in, there is a blueprint for how all different systems in the digital health ecosystem should be operating. And it's important for any digital community system that is developed and implemented to integrate with that blueprint, and in order to be able to interoperate with the other systems that are within the national digital health ecosystem. So being aware of what the standards, the agreed upon national standards for digital health systems are, where there is an expectation or hope that the digital community system will interact with other systems outside health. So, for example, I see a question in the chat about finance and digital agriculture. Like, really, the hope is that those kinds of standards have been set at a national level within, using an architecture approach, and it's really kind of plugging the system into the broader architecture by ensuring that it adheres to the relevant standards and is able to interoperate with other systems. So I'll stop there, and I don't know whether Netsanet has any thoughts that he'd like to share as well.
Thank you. Thank you, Joy. Yes, over to you, Netsanet, if you want to chip in.
Yeah, I think she has properly addressed the question. Given that we are advocating for an integrated approach across sectors, I think beyond even the digital health architecture, we need to look at the broader e-governance architecture, where other sectors that are also interested in social services at community level can also be linked into a broader digital community system. That will enable seamless data exchange between systems in social services from Ministry of Gender, Ministry of Local Government, Ministry of Youth, all these agriculture, education, only this contribute data, and also there is a need for communication, referral communication between these service providers from these sectors, and all that call for integration, and will not answer this through a national digital health architecture only. We need to look at more broadly the e-government architecture that actually goes beyond the health sector. Thank you.
Thank you. Thank you, Netsanet. I see tons of questions pouring in. I'll prioritize. The next one is for Shri. And Shri, you have been a champion for this in Southern Africa, and before that in East Africa as well. In your presentation, you shared participation and involvement of government in the entire process. So we are wondering what key lessons have emerged in fostering the leadership from the government, and also collaborating in a multi-sectoral way to ensure this approach is sustainable. Any lessons from the ground? Over. Shri, you're muted.
Thank you. Sorry. I said, wow, not an easy question. I think it's, even as all of, PEPFAR is going through sustainability, all of HIV is going through sustainability discussions and everything. I think that's one of the key challenges. And I saw in the chat, someone else had also asked about like the digital public infrastructure, right? In some ways, I think that the only way we are going to achieve some of this broader infrastructure is when we start to look more holistically at the systems that we're building, right? So even when we're within the health sector, as long as we're building HIV systems and RMNCH systems and using the limited funding that we have to build those separate parallel systems, we're not going to get the overall funding we need to build the common infrastructure, the health information exchanges or the master patient indexes, etc. So it's only by kind of everyone sitting around the table and realizing that we have these elements and these needs in common, including the senior levels of government, etc., that I think eventually we can find ways to merge funding to achieve those. And I think the multi-sectoral is the same. And I think for us, like we can see there's progress in the health sector only. I think health facilities, the idea of a partner, 15, 18 years ago when partners used to create their own health information system and then take it to a facility and get a facility to use a separate parallel system was quite common. I think most countries have come around to completely rejecting that idea and understanding it needs to be planned. And I think even one of the reasons we wanted this workshop is in the community space, we haven't achieved that kind of level of sophistication in the cross-sectoral dialogue that needs to happen. And I think bringing all the diverse sectors together and starting those conversations has been great. But the TWGs are only effective if they actually meet, right? And I think until like the broader government can get behind the need for putting in place that public infrastructure, I think, well, for now, I think we're building the case. We're trying to emphasize why it's necessary, but that convening has to happen by government eventually. Hope that helped.
Thank you. Yes, Shri. Thank you. And Pascal, if you don't mind, I'm going to put you on the spot as a follow-on to Shri's question. You have worked in Kenya through Kenya HMIS in integrating different sectors together, be it finance, be it agriculture, be it primary health. So can you share your insights into how the underlying public infrastructure could be integrated and be helpful? Over.
Yeah, thank you. So there are no easy answers to this. And what I see the opportunity here with this toolkit is that we are looking at having a very clear use case for integrating with the digital public infrastructure very early. From my experience, what I've seen is that the digital public key infrastructure is normally designed and rolled out top down. You have the shared utilities designed at the national level and then rolled out through a layered approach down to the communities, if at all. And what this Digital Community System Toolkit does is then it makes a case for utilization of those digital public infrastructure right from the bottom going up. As Joy was taking us through the use case in terms of linking up with the enterprise architecture and so on and so forth, you saw that the requirements were generated from the persona, right? How, at what point does a persona, does a client, a community healthcare worker interact with the master patient index? That is defined at the bottom, right? So what I've seen is that I think the value of this is that then you can then refine and evolve the digital public key infrastructure in a very different way that is person-centered right from the bottom. Now, in our experience rolling out Kenya EMR to be facility-wide, I think there is a combination of both. One is that the digital health superhighway being set up and the requirements being set up at a national level, but then being ground-truthed at a facility level, whereby you go through control deployment and those define certain non-functional requirements around security, around specific issues of consent management, and so on and so forth, those being defined at the lower level so that you have then a combination of both approaches. But definitely it's not easy. One, to design and implement and scale such public key infrastructures. Secondly, in terms of then evolving those to match with the needs that are emerging as you do your control deployment. I see a question from Alice Mugisha. Allow me to respond to that because I think it's an interesting question. At what point do you then involve the end users? And I'll invite Amarynth to speak to this because we'd like to involve the users as early as possible. Traditional approaches have data collection as a primary need. The proposed approach right now is that it's person-centered, right? And person-centered here could be the beneficiary at the end of the day. It could be the healthcare worker. It could be the Zuri that Amarynth was talking about. So you define that persona and make sure that they're involved right at the beginning, not as an afterthought. Amarynth, I don't know if you'd like to chime in on that.
Yeah, I think the only thing that I would add, I agree with everything you said and was listening because I think you really articulated everything well. The only thing I would add is that to develop that real user persona and the real user journeys, you have to be engaging with people. They have to be involved. They have to be telling you what their needs are, what their motivations are. And you can do some of that in a workshop context, imagining it, but you're not going to really be grasping the reality of the situation unless if you have the user at the table. So involving the user from the start is what I would be recommending. Obviously you need to be respectful of people's time and stuff, but having users involved throughout the development process is going to be what helps ensure that the tool really is user-centered and person-centered at the end.
Thank you, Amarynth. Thank you, Pascal. It was really, really well said. I see another question, and it's the last few minutes of the webinar. I'm going to ask Netsanet to share his thoughts on David's question, which is on community-led monitoring. Netsanet, over to you.
Yeah, thank you, David, for that question. It's actually a very interesting question. I think as one of the beauties of the person-centered design approach that we are advocating here is that you can bring all these different use cases into the discussion. We saw that during the workshops in many of the countries have actually prioritized clients and community members as one of the priority personas that they want to build their digital community system, and went on to identify use cases that include some of the key elements of the community-led monitoring, including access to data, actively engaging in tracking and assessing the delivery of public services, and also actively engaging in the decision-making process during engagement with facility leadership and with the service providers. And all of that has been captured. I think the design approach allows each persona to study each persona in terms of what their pain points are and what they want to achieve in terms of the opportunities that the digital tool can provide. And I think this is one of the areas that has been captured. Many countries are having community accountability programs, which is not supported by digital tools most of the time, and access to the data and ensuring active engagement of community members has been a critical challenge. And this process allows to capture that use case and prioritize it for development as part of the broader digital community system. Thank you.
Thank you, Netsanet, for the response. We are almost at the time. We can take one quick question, and Shri, I see this question might be more suitable for you. In your role as the regional USAID person helping 5 countries in Southern Africa, and you have been champion of South to South support within the countries. So as countries aim to scale their community systems, what role do you think regional collaboration and the shared frameworks can play in building the countries together? Over to you, Shri. I think you're muted, Shri.
All right. So I think there's been some great examples of that have been achieved through this process. You know, I think like bringing in, so for example, when one of the countries was hosting their workshop and they would bring in different experts from the other countries to help convene and facilitate the discussions. You know, the first facilitation that we had, I think we brought in a lot of USAID and Data.FI experts from like well beyond the region. And then I think as we've now been implementing some of them in countries, I know, for example, an Eswatini expert went and helped Botswana and things like that. So there's been those opportunities. I think we want to try and find more still. You know, human resources is definitely one of our biggest limiting factors. And so creating those opportunities. And, you know, I think sometimes we underestimate how much we get to learn. You know, I feel very blessed at times that I get to work in all these different countries because I learn so much from every one of those opportunities. And I think creating those opportunities for that cross exchange both help the recipient country in terms of the experts coming in, but that exposure to different stakeholders in different environments also helps that expert when they go back to their country. And so, yeah, I think that's just something where we have to constantly keep pushing for more and more opportunities for those exchanges. Thank you.
Thank you, Shri. And we are spot at the end of the time for the webinar. Thank you all for joining. Just a quick mention, we will be at Global Digital Health Forum in Nairobi. Please visit the stall. We will have copies of Toolkit. We will have additional resources for you to take. And as promised, we will share the webinar recording to all the registered users and link to the Toolkit and resources. Special thank you to our panelists for sharing your valuable insights, for addressing the questions, and also demonstrating the practical application of the toolkit. And for participants, thank you for your time, your insightful questions and comments in contributing to this rich dialogue. We look forward to hearing from you and about your experience in using this toolkit. Thank you, everyone.